Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patient to access the right treatment on right time. Let me introduce our esteemed guest speaker for today's live session on mental health in cancer by Dr. Krishnamani, a distinguished expert in the field of medical oncology and has more than 10 plus years of experience. Dr. Krishnamani will share his valuable knowledge and insight with us today, guiding our exploration of the profound connection between our mental health and the cancer. So please join me in extending a warm welcome to Dr. Krishnamani. We are honored to have his expertise enriching our discussion. Doctor, welcome to the live session. I will request you to give some opening insights to this exciting session on mental health and cancer.
Hello and everyone, welcome to Cancer Reach. As always, Cancer Reach is an initiative to spread awareness about cancer. This week we have chosen a topic which is not discussed very often. It is rather brushed under the carpet, or many people do not think it is as serious as the importance it has to be given. And that is mental health in cancer, which applies to the patient more importantly, and also to the caregivers and the people who take care of the cancer patient.
Thank you, doctor. Actually, rightly said, doctor. Nobody thinks about the mental health after detection of the cancer. Thus, vice versa goes with the family also. So, doctor, let's begin this enlightening live session. Just to, before going, doctor, what is exactly a mental health and issue in a cancer and how common it is seen in your day-to-day practice, doctor?
See, when you talk to a cancer patient or a patient who is taking treatment for chemotherapy or who's been diagnosed, there is anxiety, there is fear, there is why me? Why should I don't drink, I don't smoke. I am a very spiritual person. I'm an noble person, but why me? Why this? Because the word cancer means fear, means death. It's as though there is a death sentence from above, from the heavens. So that feeling of fear, anxiety, depression, okay, a sense of not accepting the diagnosis and all those things. So that is extremely common. Because see, cancer is not one, the name itself is dreadful. The disease is dreadful, no wonder. And it's not a one day affair. It's not like I have a heart problem today, go, you put a stent and I'm fine. For the patient, it's a psychological thing and it hits them very hard. So almost in practically every patient goes through some mental issue or the other. And that's why this is such an important issue. The problem is also that though patients know it's an important issue, sometimes they may not come out. They may sulk. They may become introvert. They may just keep it to themselves. They will not open up. The reason is being, depending on the culture and the place from they are, certain things are more in priority. Oh, will I lose my hair? If I lose my hair, if I go out, what will people say? They say your skin will become dark after chemotherapy. Then they will say that you're becoming unrecognizable. What will my relatives, my friends say? So that weighs more on your mind. The people have said that if I take chemo, I'll become bedridden. I'll have a lot of vomiting. So these are all the issues. Somebody took chemo and they died. See, these are all the things which some friend, some relative, somebody will put it into their mind. And so this adds to your mental burden. And over that is the primary problem, that why did I get this disease? How will I face this disease? And lastly, and most importantly, the support system they have. If you are alone, if you stay away from your family, that's a big problem. And that adds to your woes. You don't have anybody to share. You don't have a great set of friends. And finally is the financial issue. In a country like ours, where we are paying from our pocket for our treatment, you are having a plan. You feel that, okay, at this age, I will buy a vehicle. At this age, I'll probably marry and have a house. And then suddenly you're diagnosed with cancer and everything goes haywire. And or for the kind of people that, where do I get money from? This is so expensive. I don't have an insurance. So there are multiple factors. It is not one factor. So, and these factors differ from place to place, person to person, geography to geography. The mental health issues you see in the young are different from the middle-aged to the old, men versus women, India versus maybe in America. Okay, so a north versus south. So there are a lot of factors, cultural factors, socio-economic factors, and basically the way somebody can cope up. So you may be an example, a person who takes things very positively, and I may be by nature a very timid kind of a person who gets scared, and then so it depends on how a person is going to react. That is why we have to speak more often about it. We have to talk to our patients, talk to our relatives who are suffering from this, try to get them out of it, ask them to open up, and have a two-way communication. Because remember, as a fallout of this can be suicide also. Patients do develop suicidal ideation. You don't want them to go there. Imagine I have stage 1 breast cancer, I'm almost 100% curable, but the word cancer and I'm not counseled properly, and I try to commit suicide. That's a shame on the system itself, that this system has not been able to cure a patient who otherwise will lead a very, very healthy life.
Wow.
So this is a very large looming issue which has to be addressed. We cannot keep it under our wardrobes or on the closets. It has to come out. And patients should talk, caregivers should talk, counselors should talk, and doctors, if and I doctors should get time or should make time and they should talk. Not only ask about nausea, vomiting, fever, neutropenia, WBC count, etc., but also ask how are you doing? Are you able to do your activities? Are you mingling with your family? Are you eating food together? Do you watch TV? Do you have some recreation? Do you walk around in your apartment park? Do you go somewhere here and there on weekends? Okay, so these are all the things which are important. Is your family supporting you? All these things are important.
Doctor very truly said, many of the oftentimes actually the definition of beauty with color and the hair loss has given a major impact to the patients. Everybody think that I will lose my beauty, I will become black, like you are rightly addressing. So it's a very challenging subject, doctor, if I'm not wrong, and very difficult because person to person, mind to mind changes.
So, yeah, it is. I will not make it as a general statement, but see, in our country, at least, we are obsessed with fair skin.
Yes,
Okay,
very
we want girls who are fair. We want even British-looking girls or boys to use Fair and Lovely and look even better. Even our superstars try to apply on TV. Okay, in the movie itself, they try to apply all kinds of things to look fair and impress. So this is a okay. This is not a joke or a parody, but the problem is it is not a problem per se. It is a state of mind where we are bothered more about appearances.
yes,
Okay.
yes.
I used to have a teacher who was completely bald in a very, very young age. He was an ophthalmologist. He was hardly in his 30s. And he used to make fun of himself in front of all of us. And we all used to have a hearty laugh. He used to say, the summer months, um, uh, I have more of a problem than you guys because I will not have a problem because the sun gets reflected, hitting on my sunrays get deflected, hitting on my scalp. Very simple kind of a thing. But the thing is, see, appearance and all that is secondary. As our elders used to say, beauty is from within. And forget that part. The most important part is, see, we have cancer and we need treatment and we need to survive and be cured. Losing hair, having a few dark nails. I tell my patients, you have dark nails. Come on, apply your nail polish every day. Change your color. You are lucky. I cannot do all that and come to work. You can do that. Okay, you have good wigs available now. And most importantly, what we tell our patients is, see, don't bother about what somebody's on the street is telling you whether you have hair or not. That man or woman is not coming to you for chemotherapy when you're suffering. They're not
Yes,
lending a helping hand. So don't bother about what people say.
very true.
You take care about yourself. Your mental health is extremely important. As Martina Navratilova used to say, the game is not played on two ends of the court. It is played between the 2 years. That's what she said is a success, is a reason for our success. That's what we need to tell people, that the game has to be played between the 2 years. That's in your mind.
It's the mind.
And once this is set right, everything else falls in place.
And doctor, if this is right, everything is in a better place and everything is solved, doctor.
Perfect. Definitely.
Doctor, like, why do you think that it is not addressed that much?
See, our preoccupation, as we just said, we're preoccupied with the appearances, our preoccupation with the stage. Suddenly, generally, all of us are patients per se. I'm talking from a patient. So, what stage I am in? See,
Hmm.
the medical stage, what an oncologist would describe, is different from what the common man thinks of a stage of a disease. I'm not saying you don't have a right to know what you're suffering from, but preoccupation with certain things is not needed. You should be preoccupied by what should be my line of treatment, how I should take it, what is my doctor's advice, etc. And obviously, we cannot. The onus is on patients and their caregivers. They have to leave work one day. They have to come. They have to take job cuts. They have to face unemployment sometimes. They have to pay from their savings, which is called out-of-pocket expenditure or catastrophic expenditure. All these weighs on their mind. So when finances are a big thing for you, you cannot bother about your mental health. Rather, it will suck you into
Hmm.
um, poor mental health. So this needs a holistic approach. You need somebody to sit with you and counsel you first, saying that, see, this is the disease, this is what is going to happen, and this is a likely outcome. And then you need to sit with you and discuss about your finances and the way forward for that. In India, we have wonderful scenarios like, see, for example, for finances, you have the government schemes for the poor, you have CGHS railways for those kind of employees, you have private insurance for people who can pay. But there is a significant group of people called the I forget the term. It's called, I think, the middle third or something. The middle third is that group which has to pay from the pocket.
Yes.
So they don't have any kind of an insurance also. They don't have any government backing them. They have to pay from their pocket. And once a disease like cancer strikes a middle class family, it's pretty tough. It adds to the mental health. And that too, if it is happening to your child, to children, is even more challenging. And more so in young adolescents. Imagine there's an adolescent boy or a girl during those teenage, when they grow through a lot. At that time, they are having cancer. Their intellect of how to grasp things is different, and then their reaction will be different. So that is the time when you should help them navigate
Hmm.
rather than shout at them or feel. You need not pity them, but rather you need to take them through, because cancers in the young are very, very curable. I'm not a pediatrician, but yes, we have treated patients earlier. By dictum, cancers in the young are curable, highly curable. So you need to give the chance to those kind of kids, and their mental health is extremely important.
First of all, doctor, the main thing is the awareness on main thing is that cancer is not always a death sentence. So it is curable. That is one thing which need to be spread a lot around the across the world, doctor. Doctor, uh, am I
I'm
audible,
sorry,
doctor?
I think there was a loss in connection. Sorry.
Yeah, yeah. Doctor, generally, how do patient reacts when they come to know that they are having some kind of cancer in your daily, as per your experience?
Why me is the first thing. Why did I get cancer, doctor? What did I do? I have, I don't even drink tea. I
Hmm.
don't smoke. I don't drink. That's why me. Fear, depression, anxiety, anger. Okay. A sense of inwardness. Everything put together. Could be different shades for different people at different time points. But this is what they go through. And denial. No, I
Yeah.
don't have cancer. No, it would not come to me. No, I have not done anything wrong. Excuse me. So those are the ways in which people would probably react.
Actually,
It's like common to any kind of a scenario, right?
yes, doctor.
Imagine you have a good new car today, and immediately within 1 hour you come out of the showroom and you have a major accident. What will you go through? You will get full insurance. Don't worry about it. But you have a sense of grief,
Yes.
anxiety, some palpitation going on. You'll run here, there, helter skelter, call these people, that people, insurance, those guys. See, if for a non-living thing, if you can worry so much,
Yeah.
imagine if you and me are going to have it for ourselves. And you see, if a person comes to me, do I give them 100% guarantee that you'll be 100% cured? I'm not God. So imagine from the patient's point of view. Okay, this doctor is saying breast cancer is a good cancer, 98% will be cured. But what if it comes back? What if there is some late toxicity due to treatment?
Hmm.
So that if lurks in the mind. And also issues because of, see, breast cancer patients undergo mastectomy. It's not an easy thing. We have to understand it's a part of your body, part of your soul, which is taken out. Yes, many women are very brave, they understand, but yes, they go through a lot of psychological thing. It has an impact on sexual function also. Women, men and women, sometimes they have colostomy bags. So for intestinal cancer, we put a bag outside and which collects the fecal content, and they have to empty it. It is
Oh,
not a happy sight. It is not a happy sight. So people
yes.
have told me, doctor, when I travel, it is embarrassing. When I
Oh,
travel, I have to be very careful about the bag that it should not get ruptured. I have to carry extra bags with me. So cancer per se, its treatment and post-treatment life is not the same, and it is not easy for everyone. So we have to understand that. Post-treatment, you can have severe fatigue even after many years. Your body is not the same. Okay, it's just like the way you say a woman is not the same after pregnancy.
yes.
At least that's a natural process. But here, you're pumped with chemotherapy. Yes, you return back to normal, everything, but definitely it has an impact on your bones, on your general health, on your weakness, especially for women post menopause. Because
Hmm.
post menopause, they don't have the hormones. So we have to understand all that. They'll have mood swings, hot flushes, depression, anger, palpitations, excessive sweating, osteoporosis or bone weakness. All this can add to the mental health.
Yes.
Constant checkups. Patients tell me, they come for a PET scan follow up or a CT scan follow up. I say, everything is fine, don't worry. They said, thank you. From yesterday, we have not slept. The day we have PET scan, the day is like an exam for us. And mark my words, ask most patients, they will tell you this. When they
Oh,
come to a doctor's clinic, that follow up, that is scary for them. That's called, the BP goes up. It's called white coat hypertension. Imagine you've been cured, you're treated, and you're coming once in 6 months. You're okay. But the day you know, okay, day after tomorrow, I have to meet oncologist in his room and I have to get evaluated and show him the blood tests and maybe have a scan. Those 2 nights, that patient will not sleep. So it is difficult. It is very easy for me to say because I am not going through that pain, but I see that pain and suffering in most people. So first thing as society, what we have to do is understand that it exists, acknowledge it, and try to help navigate these people. Doesn't take anything. Extra 5 minutes. Sit, put your hand over their shoulder, tap, tell them things will be fine, talk to them, hear them out. You are done. That's it.
actually, doctor, right now you said those three words are very powerful. Accept it, acknowledge it, and navigate them. Those are the three solid words which will help a cancer patient to come out or come out of the fear and have a healthy mental health, doctor.
Agree. True.
That's very interesting. Doctor, is there any ways where we can help those patients to come out? Can you enlighten us on that?
Most importantly, as I told you, we have to learn, we have to first know that this problem exists. We have to sit and listen to them, have a ear, give a ear to them, ask them, allow them to open out. So
Hmm.
this is all a discussion. And if you feel there is some organic basis to this, that is, it's not
Okay.
always psychological, then you have to treat it maybe with medication, maybe with other kind of therapy. But we have to acknowledge it and we have to move forward.
Actually, doctor, during, if I'm not wrong, just when a patient comes to know, we cannot list the number of tensions what the patient will be thinking in the back of the mind. Even that also will weakens the getting cure rate of a patient.
Very much, and more importantly, many times patient will not open. If a patient comes for chemo regularly every 3 weeks and no
Hmm.
side effects and all that, she is doing well. We have seen that. A lady who comes and takes targeted therapy, she does very well.
Hmm.
Always comes happy, doctor, how are you? Okay, I'm fine. I have this issue, that issue. One time silent. She's not talking during one session. She just came, no eye contact, just eyes lowered. I asked, how are you, madam? Fine, sir. Any issues? No, sir. You get to know there is something wrong. And then you say, come on, what is happening? Her eyes are wet. Some issue in the family. Some odd discussion with son, daughter, daughter-in-law, spouse. I don't know. But you need to ask. Hope all well, things are good. See, that is also what they expect.
Hmm.
Okay. So, see, my grandmother tells a very simple thing. When somebody comes to your house, the first and the smallest thing which you should tell them is, please come and sit down, offer a glass of water. Nobody wants you to give sharbat and ice cream.
Yes.
You stand at the door, make them stand at the door, don't give them a chair. That is indecency. That is not civic sense. Similarly, when you talk to your cancer patient, also any patient, welcome them in, let them sit down, offer them a chair, talk to them, ask them what's happening, try to deviate beyond the topic. They'll probably come out. Because once they come out, they'll be ambassadors for this problem. They will
Very,
counsel.
yes.
And most importantly, you need patient advocacy groups, which is not a big thing in our country, but which will come up. I talking today is like somebody giving sermons,
Hmm.
but somebody who has suffered, who is a part of it, who has gone through it, if she or he narrates, the other person will grasp it more. So you
Yes.
can form a patient advocacy group where everybody is a part of it. They can share their experiences. These people who are seniors or who have gone through, they can tell what we have gone through, how you have to go through. The newcomers or the people who have just started off their treatment, they will understand. That's the whole point.
Actually, doctor, right now you have rightly said about the advocating groups kind of a thing. If I'm not wrong, out of India, it is like in US and New York, it is very common. They
Here,
have
why are we common? Doctor, uh, I've don't tell anybody that I have cancer. Huh. Now, suppose I'm a cancer patient. I'm cured. I come to you. Tomorrow, I get my friend to you. Before I get him for the first time, I will walk into your room and say, Madam, I've got my best friend, but he doesn't know I have cancer.
uh,
So, when you are skeptical about it being known to people, how can you share your experience with others?
very true.
So, what should you tell? Is it a sin you have got cancer? Have you prayed, God, give me cancer? Have you done something to get this cancer? No, it's not your fault. Face it. When you face it and overcome it, you can counsel thousands of people. So that is why in the West, the culture is different. They are not scared to face it, saying that yes, I had cancer, I lost my hair. So you need those kind of patient advocacy groups.
In fact, doctor, just add one thing now. Over here, as you rightly said, cancer is a kind of a sin they think. That is also, if I'm not wrong, somewhere a society has created an impact like, oh my God, you got cancer. That if a girl getting cancer, it is difficult for her to get married because they think that it's
Earlier, 3 generations before, having a girl was considered unfortunate. Dark
ex-
skin was considered bad. So even this will change. Those things changed. Even this will change. We just need to speak up and speak up more often. It's not only when Deepika Padukone speaks about depression. There are thousands of people who are in more depression and who are in a more serious condition than her and who are suffering a lot. Just that doesn't come out.
Yes, that's very enlightening. Actually, so this kind of a topic, no, I think how much you discuss each and every patient yours can be one story, doctor.
I think we should do one session on that. Some real life examples, and we'll probably do that in the next couple of weeks.
That will be really, and you can say a lighting or an encouraging or a brave part for the patients who are already going through the same pathway.
Agree.
At least online advocacy, doctor, we can start so that
We
at least
should. We should.
people will come out and discuss about this because this is such a uh, dicey concept. Many people hide themselves inside a box.
See, also, if you look at from a commercial point of view, what's the money in this? So who is going to invest in this?
Uh-huh.
See, so that is where we have to come out saying that. See, everything is not about cause-effect relationship or putting money and getting returns. If somebody's mental health is going to be superbly good, that person's productivity will be that much higher and he will contribute for the economy, GDP, whatever numbers you want to give. So bottom line is you want a very healthy society, physical, mental, that is what is health. What is health? Health is a function of physical, mental, social, and spiritual well-being.
Oh.
I may be physically one pile one, but mentally weak. I may be cutting my wrist. I am not healthy. Okay. I may be physically, mentally strong. I'm killing people. I have no fear of anything in the world, God, or even if I'm an atheist. Though I'm spiritually not on the right track. So I'm not a social person. I'm not a social animal. Man is a social human being is a social animal.
Very true, doctor.
It's a state of functioning of a physical, mental, social well-being. So mental health plays a very important role, especially in chronic diseases like cancer.
Wow. Very truly said, doctor. Doctor, just out of the box, if right now you have rightly said a patient's being inward, is there something reading book or something which can the patient cannot discuss, but they can for a temporarily come out of that grief or that mental stress of being in cancer? Is there any other
Sorry?
option? Is there any other options apart from talking to some other people, like for a temporary base?
No, you have so many. See, I think there are podcasts of people who have gone through cancer or some really great people who have struggled a lot. Basically, you need some motivation, some encouragement. Read good content from good cancer societies, like American Cancer Society is a very good content. There is a helpline by the Tata Memorial Hospital, which offers also psychological help for, I think, from 10 to 5 on Monday to Friday basis, except national holidays and Saturdays and Sundays. So that's a very noble concept. So many people are doing, but we have to still scale up, and even that is still the tip of the iceberg.
So actually, doctor, right now who are listening, our audience, they can also just go through these kind of alternative where they are not free to talk to somebody else and reduce the grief. So there are so many options available.
This is, see, to be honest, if we are coming to the end of the talk today, this today's episode is much closer to my heart than any of the episodes we have done till today. Because the information in all those episodes you can get anywhere also. Not that you are not going to get this, but this is so important that we are addressing a very, very important thing which is seldom addressed. This topic will be a footnote in a textbook I will write and give you. But it needs to be given much more importance.
Yes, doctor, because this is, as you rightly said, physical, mental. Mental is a first part to play a role for a patient to move ahead and get cured by a cancer with a bravery.
Correct.
So, doctor, by this interactive session, and I hope, doctor, as we had discussed in the coming session, we have a live patient experience which we can circulate the message to our audience. So by this, we have just came to end of the session, doctor. So before closing this enlightening session, doctor, would you like to have some closing remark for the mental health in cancer for cancer patients?
The only thing which I would tell our patients is it's not your fault. And let us face it, and let us all face it together. You, your family, your friend circle, your extended family, and your treating physician. Everybody is with you in this journey. Have trust. That's a very important word, and faith.
Trust and faith, doctor. This is one of the message we can just go ahead with the and thank you once again, doctor, and thank you everybody in the audience. So we will continue the strive of great spreading the awareness, and also with the trust and trust, we will try to fight our mental health for the cancer patients, and as well as everybody will contribute. So by this we have came to end session. Thank you, goodbye, and everybody take care.
Thank you so much. Bye bye.